About the wide complex tachycardia. So we have is ventricular tachycardia. It's typically a regular rhythm. The rate's over 100, and the QRS length is like how big it is. It's more than 120 milliseconds. Most commonly due to structural heart disease. So there's something wrong with the structure of the heart disease, like cardiomyopathy, scarring after myocardial infarction. There is a high risk of sudden cardiac death, of course. So this is how it looks like on ECG strip. It's regular, as we can tell over here. The rate is over 100. Okay, and the QRS complex with his like 120 milliseconds. And of course, it has a high susceptibility for sudden cardiac death. While for the Torsades du point, what it basically means is twisting of the points. It is something that we can see in the ECG strip. It's a polymorphic, so it's more than one shape. Ventricular tachycardia, so the origin of the tachycardia is in the ventricle itself. It has a shifting sinusoidal waveform, so it's shifting like not in the same shape all the time. Is just going up and down depending on the contraction. So it may progress to ventricular fibrillation, which we'll talk about in a minute. It has a long QT interval, predisposes. No, it doesn't have. Actually, says that long QT interval is the thing that predisposes to Torsades du points, and this can be caused by drugs or reduced potassium, reduced magnesium, and reduced calcium. So this is what we have over here. These are the pleomorphic uh, ventricular contractions that don't have one shape over here. So, and then they go up and down, and that's why it's shifting. So it's not the same thing all the time. The treatment is magnesium sulfate. We have also the drug-induced long QT because we know that now the long QT. So if this is a normal strip, PQRST, so PQRST. So it says that if we have a long QT interval over here, then that would predispose. If it's long, then it will predispose to the Torsades de points. So one of the drugs, like many drugs, actually can lead to this elongation of the QT interval. So these drugs are antiarrhythmatics, class 1A and class 3, and also arsenic. So this is just for memorization. They're both mentioned here, arsenic drug and also the antiarrhythmatic drugs, class 1A and class 3. Also antibiotics we have, just like macrolides or fluoroquinolones. Okay, that should be fine. And also antipsychotics like haloperidol and chloroquine. And then we have antidepressants. They also like tricyclic antidepressants and diuretics as well. They both have D. The diuretics, just like thiazides, they will also elongate the QT interval, which by itself may lead to Torsades du points. We have also antiemetics like aldosterone. That's something that is commonly used, and antifungals like fluconazole. We also have Navir, that is protease inhibitor, and opioid, just like methadone. So all of these drugs, there's so many, and in order to memorize them, so it's A, B, C, D, E, F plus the NO, that is for Navir and opioids. All of these may lead to Torsades de points. Torsades de points may end up as ventricular fibrillation, and it is disorganized rhythm. So as you can tell here, it's just disorganized. There is nothing close to regular, with no identifiable waves, like you cannot tell where is the P or the QRS or the T, so nothing identifiable specifically. And it's of course fatal without immediate CPR. So whenever you see a ventricular fibrillation, that means an immediate CPR, and also the use of defibrillator. Now that's for the wide complex tachycardia. That's the basic the reason why they're called wide, because they may have a wide QRS, but as we have seen over here, it doesn't necessarily have that nice, beautiful QRS complex to consider it white. So the conductional blocks, we have, let me see here, conductional blocks. Okay, so we have Mobitz type 1, Mobitz type 2, and then the third degree complete AV block, and there is a small thing called the bundle branch block. Okay, so for the first degree AV block, ooh, yep, okay. So for the first degree AV block, like atrioventricular block, there is a prolonged PR interval more than 200 milliseconds, and the treatment is not required because it's benign and asymptomatic. So even though we have a first degree, that doesn't necessarily mean that we need to do something about it. It just means that there is an elongation between the P. This is the P, and this is um, QRS T. So there is a longer period than usual between the P and the R in the QRS complex. And we know that the P is the depolarization of the atrium, while the QRS, so it's the depolarization of the ventricle. So that means basically the signal is moving from the atrium to the ventricle. So if it gets longer than expected, as we see here, then because we said it's more than 200 milliseconds, that means there is a delay in the conduction velocity. That means kind of a block because the ventricle is getting the signal to contract a little bit slower than it should. So it's, as we said, a prolonged PR interval, and it's more than 200 milliseconds, and treatment is not required because it does not produce any symptoms and is considered benign. This is for the first degree, while the second degree has multiple names. So we have the Mobitz type 1 wink pack, and then Mobitz type 2. So the second has two types. Okay. And it has, wait a second. I don't think this is considered. Yeah, I think this is considered totally different. Okay, so for the second degree AV block, then the Moptis type 1, it's a progressive lengthening of the PR interval until a beat is dropped. So P wave is not followed by a QRS complex anymore, and we have variable RR interval with a pattern, and that is regularly irregular. So what is happening here is that we, of course, we have the lengthening of the, this is P, Q, R, S T, and then P Q R S T P Q R S T. So what is happening here is there is a lengthening, an actual lengthening of the PR interval, but it's getting longer each and every time. So that's the difference. That's the main difference here. So there is a progressive elongation of the PR interval each and every time. So this one is like this PR interval is bigger than the first one, and the third one is bigger than the second one. So until we get to a point where only we have P wave but no QRS after it, as we see here. So there is a QRS complex that has been dropped and doesn't exist anymore. This is the Moptis type 1. So it's a progressive lengthening of the PR interval until a beat is dropped, and that is the P wave is not followed by QR complex. We have, of course, variable RR intervals with a pattern that is regular and irregular, because we said that the PR interval is getting longer each and every time until it drops a beat. That means the RR interval is also getting longer every time until we drop a beat over here. So the treatment is not required because it's also usually asymptomatic. So let's say that type first degree AV block is was also asymptomatic, then type 1 is also asymptomatic. I'm not sure if that helps, but it should help with memorization. For Moptis type 2, it's dropped beats that are not preceded by a change in the PR interval. May progress to third degree block, and it, as it's usually indicates structural abnormalities such as ischemia, fibrosis, and or sclerosis, the treatment is usually a pacemaker. So this one is kind of serious because it requires treatment, and the treatment should be pacemaker. So what we have is that we also have a dropped beats like a complete Q RS X complex is lost, but that doesn't necessarily have to have a previous longer PR waves, like PR waves of longer of different lengths as we have seen here. So it's basically the same thing. This PR interval is exactly the same as this PR interval, so there is no progressive lengthening over here, but even though we are dropping a beat over here and we are losing a QRS complex. So that's the Mobitz type 2, so it's a drop beat that are not preceded by a change in the PR interval, so they're constant. It may progress to third degree block, and it indicates a structural abnormality such as ischemia, fibrosis, sclerosis, and the treatment is usually a pacemaker. And that should be it.